times do you get an invitation to go to dinner or breakfast or maybe meet a friend for coffee? It's a social time, a time to share friendships and enjoy some conversation. The same for our residents with dementia. Their dining experience is also a social time and a time to meet their nutritional needs. Welcome! Today we're going to be talking about dining for our dementia residents.
During this video, we will be discussing environmental considerations, safety concerns specific to dementia care, assisting persons with dementia during dining, as well as behavioral considerations such as refusal. One of the most important factors for creating a successful dining experience for persons with dementia is the environment. You want to create an environment that is warm, comfortable, and inviting that will encourage the person with dementia to remain at the table and finish their meal. Some key environmental factors to consider include noise, lighting, table setting, table mates, that is the person whom they're sitting with, how the food is served, as well as overall comfort.
Creating an environment for our residents so that they recognize it's mealtime is very important. One of the things to remember is to always make sure the environment is set ahead. Have the chairs in place or perhaps an empty space for someone who may be there in a wheelchair. Have the table setting very simple with a plate and perhaps a contrasting background is always effective for the resident. Talk about the food. Mention what's on the menu and what a pleasurable experience they're going to have sharing that meal. Mention whether it's breakfast or lunch or dinner to help with orientation. One of the things we want to make sure of when we're setting up for our resident dining experience is to think about the noise factor. Clanking dishes and forks and spoons would be something that could be very distracting to the resident. Don't forget about music. Nice, pleasant music can be enjoyable, but make sure it's resident choice music. Make sure it's soft and background only, and watch for any resident anxiety increasing. Sometimes music can be distracting and they may not eat as well. So please be sure to eliminate music altogether if this is the case.